Hello, I'm Howard Chansky. I'm the chairman of the Department of Orthopedics and Sports Medicine at the University of Washington. I'm going to discuss the 5 hospitals that comprise our residency, and I'm going to start with the University of Washington Medical Center. The University of Washington Medical Center is a tertiary and quaternary care medical center that cares for patients with complex orthopedic problems from the entire 5-state WWAMI region. The University of Washington Medical Center has several orthopedic subspecialty services. This includes upper extremity and hand surgery, spine surgery, sports surgery, total joint surgery, and orthopedic oncology. We have a beautiful new sports medicine facility located within Husky Stadium, which is situated across the street from the medical center. This facility gives our residents the opportunity to care for high-performance athletes from around the region, as well as for the Husky intercollegiate athletes. Located several miles north of the main University of Washington campus is Northwest Hospital. Northwest Hospital happens to be situated in a very beautiful park-like setting. Northwest Hospital is where our residents gain most of their training in complex adult reconstructive surgery. We also care for general orthopedic trauma at Northwest Hospital, and we have a busy shoulder, elbow, and hand surgery program there. The residents have the opportunity to work with academic surgeons in a private practice-like setting at Northwest Hospital. This is the ideal environment in which our residents can prepare for a future in which they will be expected to be not only talented surgeons, but also efficient surgeons. We are fortunate to have one of the busiest VA programs at a Veterans Administration hospital in the nation. At our VA hospital, our residents see patients with very complex orthopedic problems, and they come from the entire WWAMI region. The nice thing about the VA is that in a very supportive environment of graduated independence, our residents learn to become confident, independent surgeons. I know at the end of their R5 or chief year, to a person, every one of our residents after their VA experience is ready to go out and practice general orthopedics at a very high level. We are fortunate to have a world-renowned children's hospital as part of our training program. Seattle Children's Hospital is located several miles from the main University of Washington campus. It is also comprised of world-renowned faculty that care for a wide range of complex pediatric orthopedic problems. While our residents obtain some of their pediatric trauma training at Harborview, the vast bulk of their pediatric orthopedic training takes place at Seattle Children's Hospital. Last but not least, Harborview Medical Center is a world-renowned trauma center and is the location where our residents get unparalleled training in orthopedic trauma surgery. Harborview is served by Airlift Northwest, and as the only level 1 trauma center serving a quarter of the landmass of the United States, it happens to be an incredibly busy, world-renowned trauma center. Most orthopedic trauma centers are built around a model of general orthopedic trauma surgeons. Due to the extreme complexity of the patients that are served by Harborview, we've elected to use a model with subspecialty trauma surgeons. The services we have at Harborview include a spine trauma service, a foot and ankle service, a hand service, an amputation service, and a pelvic and acetabular service. Of course, the foundation of care at Harborview is provided by our general orthopedic trauma service. Thus, while our residents are challenged and work extremely hard during their Harborview rotation, their experience there is unparalleled at any other trauma center in the country. On a monthly basis, the program director, Dr. Doug Hannell, and myself will meet with the residents to inquire as to what's going well and perhaps what might not be going well. The residents know that we take that feedback very seriously and typically address their concerns in a timely fashion. In fitting with the progressive technology in the Seattle region, our residents are supported by an IT staff that works within our department. We have a digital curriculum committee that meets on a monthly basis to ensure that our residents always have up-to-date teaching materials. All of our residents are provided with an iPad at the beginning of our residency, and this iPad is loaded with every digital textbook that we feel the residents need during the course of their residency. When I had initially come out here, I had anticipated heading back to the East Coast in a year, but the incredible educational and academic environment at the University of Washington, in addition to all the natural beauty, made that impossible for me to do. One of the great things about Seattle is that if you head east for several hours, you're in high desert. If you travel 45 minutes, you can have great skiing. And if you head west across the Sound, you're actually in the only temperate rainforest. The university has not only allowed me to practice clinical medicine at a very high level, but has also allowed me to pursue my scientific interests and given me the opportunity to educate wonderful residents over the past 24 years.